Hi, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry, with this week's version of Dental Health with Dr. C. You know, a lot of people desire cosmetic dentistry. They want to look better, look a little younger, feel more confident, laugh a little bit more, smile more when they have a photo in front of them. Well, how do you go about that? Because it really needs to be individualized. And there's a lot of people that desire this, but if you're going to do this kind of thing, you really have to give it some thought and plan things out ahead of time. So you can have a variety of things that show up as problems, whether it be crowding or a crown that doesn't match or a dark gum line. And these things can all be handled, but it does take a little bit of planning up front and input from the patient. So what are we trying to achieve when we get involved with a smile redesign, so to speak? Well, what we're really looking for is something called golden proportions. It's everywhere in nature. And it's actually a mathematical ratio of 1 to 1.6 that anyone's eyes look at and say, you know, that looks right. And when things are out of proportion, you look at it and say, you know, that doesn't look right. So, the ideal proportion on a smile design, when I design a smile, is to have certain measurements that we try not to violate. Now, you can customize it and make the patient look younger or flirtier or older or more mature or more carefree. You kind of mimic the personality, but as long as you follow the proportions. Ideally, the central incisors are 1.6, the laterals 1.0, and the canines 0.6 as you look at the smile. And there's a height-width ratio. The central should be about 82% of width versus length. And when you put those in proper proportions, no matter how you characterize the teeth and change the edges so they look a little bit more natural for that particular patient, it's always going to look right to your mind's eye. So there's 4 steps we do when we evaluate the smile. We decide what the problems are, take some detailed casts, then we have the lab in wax do what we envision that we'd like to see in porcelain, and then we shape the teeth down and do that. We pick out smiles from a library. This is a little hard to see, but every one of these is a little different, and we use different characteristics to really fine-tune it for the patient themselves. So as we follow through the steps, we can take people that maybe look a little older than they'd like to feel and jazz them up. This guy actually had vertigo so bad as a result of his bite he couldn't get out of bed. But after we rebuilt his bite in an ideal place, he actually didn't pay me to make him a pretty smile. He paid me to get rid of his vertigo. And he got the smile for free. And no matter what kind of problems we get involved with, if we get involved with a full mouth reconstruction like this young lady, we really want to make sure that we've placed the porcelain in an ideal location so we don't end up with fractures and hassles. Nobody wants hassles, not in an elective procedure. And done right, that doesn't happen. So that's this week's version of Dental Health with Dr. C. Look forward to hearing from you. www.drpaulcoleman.com